All right, so once again, all right, so I've got a couple of people. I just want to do a sound check. I've had a couple of superintendents message. Can you all hear me? Can you
Yes.
all hear me? Okay.
Yes.
I've had a couple of private messages. You all should be muted, but I want to make sure that our superintendents can hear us. Okay. Thank you.
You're getting ready to get avalanches of yeses.
Okay. Gotcha. Thank you.
Tony, I just got a message from Chair Young that she wasn't able to get in. I'm going to try and send her the invitation again.
Okay. Perfect. All right, and then I'm going to go ahead and put the Google form in there again. Once again, I'm not entirely sure. I think there will be time for some questions and answers. If not, here is the link to the Google form. As always, you all are familiar with this. You can go ahead and submit your answers, your questions in there. If there's an opportunity, we will go ahead and present those. If not, we will get those back to you in an FAQ form. And then as we wait for the Lieutenant Governor and the Governor to join us, I'd just like to thank you all for joining us today on a very short notice. As a reminder, this meeting is going to be recorded. We do have everyone muted for now, but we'll be opening up hopefully for questions later in the meeting. We will make that announcement when we do, if we can do that. And at that point, you will be able to unmute your cameras.
And their mics too.
Yeah. And your microphones. Yes. Sorry. It's Friday, y'all. Sorry. Check in and make sure.
I joined a few minutes last time late, so maybe the same thing. Dr. Glass, Chair Young is on now.
Thank you.
Now, there should not be any audio yet unless you hear me talking right now. We are waiting to be joined by the governor and lieutenant governor.
Looks like the governor may have joined us.
Okay. Lieutenant Governor just on now. So we should be getting started here in any minute.
I just received notice that Governor Beshear is wrapping up a meeting and should be with us shortly. Thanks, everyone, for your patience.
All right.
Thank you, Governor. Nice to see you. And is the Lieutenant Governor on with us as well?
I had a meeting that ran long and did not make it back over to the office, thus this amazing video shot that we've got.
It looks like a very fancy room, Governor. We're glad to have you. Thanks for being on with us. Would you prefer that we wait a few minutes for the Lieutenant Governor to come on, or do you want to go ahead and get started, sir? What do you prefer?
If we can wait just one or two more, because you got to love the awkward starts of all of these video calls.
Sure. We'll sit tight and wait for her to come in.
I think I see her now. We're going to bring her up to presentation rights, so she should be on.
There you go. I'm on. I just couldn't get unmuted, so now I'm good.
Okay, welcome, Lieutenant Governor Coleman, Governor Beshear. Thanks for being with us. We have the superintendents on with you this afternoon. Thanks, everybody, for your patience. And Governor, Lieutenant Governor, we'll turn things over to you.
Great. We haven't had the opportunity to talk about good news a lot on these calls. Today, I want to talk about the best news in this pandemic, which is the vaccines. And I know that you all have had a little bit of information provided on the vaccine. So let me talk about where we are right now, what we expect over the next couple weeks. And I'm going to talk about certainly the push I'm making to prioritize educators, and then what we need for you all to prepare so that at the earliest moment, and we don't know what that earliest moment is yet because we haven't seen production schedules, we can make it available to our educators, because with a 94% effective vaccine, we're one that takes care, it looks like, of 100% of severe cases. This thing is an absolute game changer. And we want to make sure that our educators get the priority that they deserve, so that we can get back to as close as we can to an old normal as quickly as possible. So as we sit here today, we have two vaccines that are going to be up for emergency authorization. We have the Pfizer vaccine that is going to be up early next week, and that we expect to be approved, shipped, and potentially going into people's arms as early as December the 15th. That's really exciting. When we think about back to March, when we thought a vaccine would be so far away, and when we think back to, even when we were getting the early reports in June, they hoped this thing would be 94% effective is nothing short of a miracle, and I give thanks for it every day. So the early challenge we're going to have is the limited amounts of the vaccine. And so in this first round of Pfizer vaccine, we only have 38,000 doses. Now, the federal government says it's held back the booster shot of each of those because it's a two-shot, like the hepatitis shot that we did a while back, separated by about 21 days. So they'll send the first dose and they'll hold the second. We'll have the first dose for 38,000. We hope starting on the 15th. That goes in two directions, which are the top two priorities that I think we can all agree on. One is our long-term care residents and staff that right now make up 66% of all deaths in Kentucky. Our national average is only 40%. Now, when you look at Kentucky, it means that our most vulnerable are getting hit really hard, but part of that percentage is because we are doing a lot better on our outcomes and have significantly less death per capita than many states around us and most states around the country. And that's based on a lot of hard work of a lot of people. So in this first batch, this first shipment, we have to activate the long-term care program that the federal government set up, and that's CVS and Walgreens that is going to provide those vaccines, the whole thing, to our long-term care facilities. To activate that at its earliest moment, which we have to do, because I think we may be able to vaccinate our entire long-term community by the 1st of March. How amazing would that be over the next 2.5 months if we could cut out 66% of the fatalities we see from this thing? I mean, it'd be incredible. But to do that in each shipment, we have to do at least 50% of it towards the long-term care program. That's per the federal government. If not a little more, it's got to support that schedule of really once they get up and going, about 8 weeks. We think we might even beat March 1st. That's obviously dependent on how much is manufactured and sent to us, which is out of our hands, and the numbers change. I thought we'd have 150, 170,000 doses with this original shipment. We don't. So the other third of the first shipment is going to frontline healthcare workers. And I will tell you, one of the hardest things is there's not enough for everybody in the beginning. So the initial selection, and it's just the initial, was made at 11 sites geographically across the state, and will be in those facilities going to employees in a tiered basis on how likely they are to contract COVID. You know, if they're in the COVID wing, certainly they're at the top. Now, the challenge of the Pfizer vaccine is we can only ship them in units of 975. You have to have the deep refrigeration. You have to have 975 in the facility for the very first round to qualify. So we've heard from a lot of other groups that are disappointed, hospitals and the like, but you can only pick 11, and it's a challenge at this point. The good news is that we believe 2 weeks later we're going to have the Moderna shipment that is twice as large. And then I believe on Monday I'm going to have information on anticipated shipments after that. But again, even the second shipment, and I will tell you probably the third, are still going to those top two priorities. And then EMS folks that are right there as well. So that is, sometimes they call it 1A, however you want to tier it, where it's got to go first, and we can all agree on that. When you take your next step, I'm working as hard as I can, and we're talking to the federal government, and we think that they are pushing to have educators right up there in that potentially in that very next slot. And that recognizes the exposure that our educators have in the building, but it also recognizes the absolute critical importance of what you do and how much better in-person classes are. I know my kids just wrapped up their day. My son got an A on his math test. I'm really excited about that. So I want you to know that we're fighting for that and we're pushing for it. Now, what that means, though, is with us not knowing the exact ramp-up schedule, and we won't for a period of time, we're going to need to take actions to be ready, not at a moment's notice, but take actions to be ready when if they say we've approved the third and fourth vaccine, which are still out there, and all of a sudden you have 300,000 more doses coming to you than previously anticipated. We want to make sure we've put in the legwork and that we have your help in putting in the legwork to be able to get these out as soon as we know we have them and get them to the people willing to be vaccinated as quickly as possible. And that's why we wanted to have this call this early. Remember, the first one hadn't been shipped out yet. We want to have this call about ways that you can start helping to prepare. And I know the commissioner and Dr. Stack and Kelly Alexander are going to be putting together some additional guidance for what we're going to mention today. But the most important thing we need, and we probably need it within the next couple of weeks, is rosters with information broken down per school about those who are to be vaccinated, willing to be vaccinated, or I know Commissioner Glass will be talking to you about what the legal abilities are with schools. From the governor's office, we're not telling anybody they have to be vaccinated or not. We're encouraging everybody to. But the way that this is going to work is all these shipments are going to come from the federal government, but we have to tell them where to go. And what we need, weeks before, we're going to be able to have that first shipment for educators is knowing the numbers and the general location so that we can find a partner to provide those vaccines at that time. And we're going to need your help in helping to coordinate that. Because if you think about the numbers of schools and or school systems, and once we've gotten it to the provider that can work with you, us being in the picture trying to do all the rest of the details when we don't know your conditions on the ground, I think is extra bureaucracy. So we're hoping that you will take, once we have that opportunity, a leadership role in working with whoever it's going to be. If it's the local Walmart, working with them on the schedule that works best. Though the schedules, in the best case scenario, may be really tight. And that would suggest that's the good problem to have, that we have a lot more vaccine and it's available a lot earlier. There's still so much we don't know because we still have providers signing up. We still have not gotten the specific instructions for storage for the potentially third and fourth vaccine. Any of the vaccines that take boosters require us to have a partner that has enough IT infrastructure, and we'll need your help with this to schedule out the second shot 21 days later. It doesn't do us a lot of good. It does the person a little good to give them the first dose if they're willing and not get the second dose. So what we need to have again working on are those rosters. So if we have something like the Pfizer vaccine where we ship 975 at a time and it can't be broken down any more than that, we can line that up with the schools and the school systems and check to make sure that there is the best provider in the area. This is a logistical challenge, but it's one we're very, very excited to address, but it's not going to be perfect. It's not going to be perfect at all. None of us have ever engaged in what type of widespread vaccination we're going to see. And we are going to learn lessons, thankfully, from this very first rollout that's going to healthcare providers. That's going to help us move on. And we're going to have a call with those initial ones, with all the secondary, and then the third groups that are going to get it. What we can't tell you right now is whether or not the providers in your area will be able to come to your school, for instance, or that will be a site. We don't know that yet. And when we do, we'll obviously tell you. And we don't know that will be consistent throughout because of the way they've set up the provider system. Some may have a local pharmacy that's able to do this. Some may have a Kroger in their area, and we may be able to get them to do it. All these conversations are occurring in real time. But I think, at least in your mind, and I don't think you have to put this piece to paper now, think about how, with a certain amount of notice, you would get your personnel to a site that is off-site, or how you would be able to conduct it on-site. I think we just need to be prepared for both, because the best problem that we could have is this thing comes earlier than we anticipate. But I don't want to be sitting on our hands. If that happens, we all want this thing done as quickly as possible, provided that we believe that they are safe. Kelly Alexander, who I know is on the line, is our lead in the Department for Public Health, working with the federal government. She sees in real time what the federal government tells us they're going to send us, but they change a lot. We'll communicate to you what they tell us is coming, but if it's cut in half or even to a third, like the first one is, we'll just communicate that too. That's something that we can't fully control. I want you all to know that other than the healthcare providers, you're the first group that I'm personally reaching out to about this. And I'm going to be pretty clear about how important I think that your priority is. Because again, if we are lucky enough to have more vaccine earlier than we think, we're going to need your help at a time when we haven't worked out all the logistics like the way we will when it hits the general population, to make sure we have the very best program that we can. Let me just mention one other thing on the vaccines. Moderna, by the way, it doesn't require the deep refrigeration that Pfizer does. The more Moderna we get, in many ways, the better. If we can get free providers that can help. But again, those are all logistics that we're going to be dealing with in real time. So for the vaccines, what the data shows right now is that they are highly effective in preventing you from getting sick from COVID. What they don't tell us is whether or not you can spread it. So I think we ought to expect masks through the end of the school year. And the other thing and reason on that is it hasn't been proven safe for kids yet. They haven't done those studies. So we will not be vaccinating children. We also will not be vaccinating pregnant women. That is not, again, that's a separate subset that they do. And so it hasn't been proven safe there yet. Now, with that said, that we don't know if you can spread it or not, and we don't know. There's no data on that yet. If enough people get this, it won't matter, because you can't get it'll limit this thing to where one person believes Moderna, either it'll feel like a cold or a mild flu. And if that's the case, and we can get enough people vaccinated who believe it's safe, then we'll truly be in an old normal, whether you can spread it or not. I know I probably missed a couple things. Let me turn it over to the Lieutenant Governor and then Dr. Glass. We'll answer as many questions as we can, but a lot of them we don't know yet. But this is wanting to bring you in on the process. I know everybody here has a really big brain and leads large organizations, and getting you thinking about how to face potential challenges that we may have even with the best planning as we go forward, we thought was critically important.
Thank you, Governor. And I will just add that I want to say thank you also for prioritizing our education community coming out of this pandemic. For all of you on here, I'm sure you know that of all the difficult decisions that have been made since March, any decision that has to do with our schools has been among the toughest of them, because we are such big proponents of education, as all of you know, and so these challenges have impacted every community and every family. So with that said, I have a feeling one of the questions that will arise is who in the school, in terms of adults, should get the vaccine, and our answer is everyone, every adult in the building. And so I think the governor and I both refer to any person that works in a school as a teacher, because we see them all as teachers, but every person that works on your campus, whether they're a volunteer or a contract employee or a office staff, classified, certified, we want everyone who comes into contact with our school communities to be at the top of the line behind our healthcare workers. So I would just encourage you to keep that in mind as you are working through this. There are going to be lots of questions that they're going to arise as you work through this, because none of us have been through a worldwide health pandemic before. And so I would encourage you to relay those to us, both Department of Education and my office, so that we can help as much as possible. I know Dr. Glass is going to be probably talking here in a minute about the guidance that they are going to help provide along the way. And any questions that you face are probably questions that other folks face. And so we need your help in clarifying statements and making sure that we're all on the same page. So with that said, I will turn it over to Dr. Glass so he can speak a little bit more directly to the role KDE is going to play in helping.
Thank you, Governor Beshear. Thank you, Lieutenant Governor. We appreciate you being on, and this is great news. It's exciting to think about. This is the beginning of the end of what's been a really difficult period for all of us. So we're excited about that, and we appreciate you coming on and sharing this with us early on, and your efforts to prioritize educators and everyone connected with our schools so that we can get back to serving kids as soon as we possibly can. As was mentioned, we know that there are lots of questions right now around what this will look like, how do we execute it, what are all the logistical concerns. We just started talking about this as a leadership team at KDE today. We had a conversation with the governor's office yesterday, so this is happening in real time for us as well. What you can expect is that we will collaborate with the governor's office and with public health, and we will provide up-to-date guidance to you on all of the logistical questions that will be coming up around how do you collect this information, what happens if there's a shortage in your area and you're not able to vaccinate everyone that's within employed by the school district. What are all the logistical challenges in working with distribution sites within your community? Where might those be, and how do we support that? So we know that those are some of the questions that we expect to hear. There also will be a bunch of questions that we don't know yet, but we will remain committed to answering those and providing updated information as soon as we are able. We hope to provide the first initial guidance to you on this sometime next week. We'll work toward that because I know that this is going to come really quickly. But that will be a goal for us. I think at this point, Governor, Lieutenant Governor, if you're still on, and I know that we have Dr. Stack and Dr. White on as well, we're able to take a few questions. I know that we've got a couple that have come up in the chat here, and we've had Tony distributed a Google form where we may have some other questions. But if you've got a few minutes with us, we'd love for you to stick around and answer some questions.
So I have unmuted our participants. I do have a couple in the Google chat. The first one mainly is going to be along the lines of who all should be on this list of this roster list. Should it be everybody in the building, bus drivers, everybody?
Yes. Our goal is to make that as safe of a building as it can be, and to do that, we want everybody. But what Commissioner Glass said is real to think about, is that it's not going to likely be one shipment that'll cover everybody in the district. And so we do have to think within groups about priority two. And I would encourage you to think about priority based on level and potential level of exposure. Certainly those that come into contact the most with kids have a high level of exposure. Your bus drivers are going to have a very high level of exposure too. So think through that, but your schools, and having walked the halls, where some of that most contact occurs. And again, it's this thing, as much as we prepare for it, and I want you to be prepared, is not going to be seamless. And we're going to need a lot of your help on the ground, problem solving in your community when these come in, because it's going to be a really good problem to have when they come in, even if there's not enough. And I keep telling myself that today, when every single group that wanted a part of the very first shipment and didn't get it has called expressing disappointment.
And Governor, we will also be, that's one of the guidance elements that we'll be following up on is what is a suggested order within a district around if there's a limitation on it, which we hope that there's not, but in that eventuality, what would be a suggested order on vaccination?
Correct, because another question is on here is, are all school employees eligible at the same time? And I think that
it all depends on when the vaccine comes and in what quantities. And what we think is we're going to get an initial push for everything that the companies have already manufactured before the approval. And we think we'll get one of those next week. And so that immediate group will come out. And then we think for most of them that the next couple shipments they do may be a little bit smaller as they ramp up their production further. But I mean, there are so many variables about the number of vaccines that get approved and when they get approved that it's really hard to predict exactly how much we'll have when. But I would be prepared for the eventuality of maybe you have enough for one specific school, maybe you have enough for part of it. But our goal is to get it out the best we can. And not every school district will get a shipment in the first shipment at the same time. And that's going to be really hard. We've already seen it now with the first set of healthcare providers. What I'd ask is patience, and it's going to be impossible. And it's an impossible task because you want your people as safe as possible. But the reality is hard in that it's not going to be possible to send everybody, one shipment at the same time. So please bear with us but know that, I mean, help's on the way. I can't tell you exactly when it's going to come. This is going to be a hurry up and prepare and wait. But my goodness, the light at the end of the tunnel is brighter than I ever thought it was going to be.
Is there any concern? This is from the chat. Is there any concern that the second dose shipments, if held back at the national level and not shipped with the first doses, won't arrive in time?
Well, the national folks tell us that they are holding back and shipping, and we all pray that it's going to work seamlessly. That's in the hands of the federal government. We're going to control what we can control, but we anticipate that they'll get that one right. If they're doing what they say they're doing, they've got it, and then they'll just ship it.
Another question from the chat is, what will the guidance be if someone does not want to take the vaccine?
So we've got, go ahead, Governor.
Commissioner Glass.
Okay. We've got KDE's General Counsel, Todd Allen, on to talk that through with you. Todd, can you unmute and provide some guidance for us on this?
Yes, good afternoon, superintendents. Of course, I can't provide legal advice or guidance out to school districts, but we can certainly provide you information that we think is helpful. Several months ago, at the beginning of the pandemic, the Equal Employment Opportunity Commission, or EEOC, issued guidance to all employers on the topic of requiring an influenza vaccine of employees, and advised that employers can require that so long as they provide for disability and religious accommodations for their employees. So if a vaccine, the example that we had was influenza, but we think the same logic would apply to a COVID-19 vaccine, were required by an employer, there must be an accommodation exemption for individuals with disabilities or religious opposition to the vaccine. What the EEOC encourages is that employers strongly encourage and lead by example for their employees to be vaccinated. And we can circulate that EEOC guidance to you.
And I want to say from the governor's office, our position is those who want it, we want to get it too. And we're not going to put something out from the governor's office saying people who don't have to take it. But since that was the influenza vaccine, let me make a quick comparison. Influenza vaccine is 60% effective. And that's what we were hoping for in these vaccines. Thus far, they appear to be 94% effective. This vaccine is closer to measles than it is to the influenza, just in how effective it can be.
Thank you, Governor. Thank you, Todd. And that will also be one of the matters that we'll be providing that written guidance to you on, that very important question around how we can encourage employees to take the vaccine and what rights or options do districts have to encourage that.
There was a question in here from a superintendent on whether KEA has taken a position on the vaccine. Are they encouraging teachers to get it? I'm not certain on that. Have either of you all reached out?
I'm not either. We haven't had that discussion yet. Maybe the commissioner has.
Yeah, I think right now we wouldn't want to put KEA on the spot. They're hearing about this the same time that we are. Let's let them develop a statement on that and think about it just like all of us are.
Okay. The next question, how long will the vaccine protect an individual? They've read this morning that preliminary reports are that it's good for about 3 months. Can someone from DPH get on perhaps and talk a little bit about the protection from the vaccine?
I think the answer is we don't know, but if Dr. Stack or Connie are on.
You got it. We don't know, boss. And when they say 3 months, you know why they say 3 months? Because the first person who got a sample dose was 3 months ago. So that duration will hopefully get longer the longer time passes.
You know, Dr. Stack, I did hear that they believe that, well, we don't know what type of natural immunities you get if you've had it, that the vaccine is likely to last longer than that.
Yeah. So, and again, some of this, I can sound just like your attorney. I can hedge this, that this is not legal advice. What am I going to say here? These early vaccines, these mRNA vaccines, Pfizer, a really strong immune response. It could be they're generating a better immune response than the infection itself is generating, which could provide more enduring immunity. And there are different types of immunity, the initial antibodies, and then the way your cells, your B and T cells do it. It could be that this is generating a really good response, and maybe there could be multi-year benefit. So I think there's still reason to be very hopeful, but we just won't know until more time passes.
Okay. A question, should they include substitute teachers on their potential lists as well?
I think the governor has stated that everyone who comes in contact with students is on the list. So, but we'll need to do some work around what is the prioritization suggestion on that in the event that we don't have enough to go around. We hope that that's not the case. But I think what we've heard from the governor and lieutenant governor is that everyone who's coming in contact with students should be considered or provide the opportunity to take the vaccine.
And one thing we'll need to see from what you provide to us is how much do the numbers swell at what levels and what considerations. Those are things that we need to see so we can start planning ahead of time. And it's just like when we look at healthcare workers right now, not all of them face the same exposure. When you look at it, there's those that work on a COVID wing, and there's those that work in an office setting. That's just a different experience and different exposure level. But yes, we want to try. We really, as soon as we can, want to get to a point where we can make all the buildings safe for the adults working in it by deploying this vaccine.
Okay. Another question just on, is there information or fact sheets that on each of the vaccines that can be shared to help remove some fears and misconceptions?
I think there will be, and we'll have, we're going to have an information campaign starting right around the 15th to communicate to the public. And we're still waiting on, that emergency authorization is going to give some further information that we need to see. Dr. Stack, you want to weigh in on that too?
Yeah, so we will get a lot more data when the FDA goes for their hearings. So December 10 is for Pfizer, December 19 is for Moderna, and then we will have all sorts of smart people who do this around the country probably poring over that data at the same time. So again, like everything else, we will know much more and know more rapidly as the month of December unfolds. But right now, there's not enough data. We just have the press releases from the manufacturers.
Okay, and then there's another question about, will all the distributions of the vaccine flow from the state to local agencies?
I think this is a question around just distribution logistics.
Right, and we're still working through that, but at least what we believe right now is the state is told the number of allocation we designate with conditions that are there, the destination, the provider that it goes to, they make the shipments. And so what will be required is the connection of the districts, the buildings, what have you, with the provider. Now, all of that could change on the federal level, and it has before. Right now, they tell us that this is how it's going to work, so we're making preparations for it to work this way, and we anticipate it will continue to.
Okay. All right. Well, I don't think we have any other questions. I don't see any hands raised. So if you all want to conclude, I think we're good to go.
I hope everybody finds this as really good news. I hope it lifts you up over the weekend and through the next couple of weeks. Since we talked about the good news, we got to temper it a little with the bad. And that's that it looks like the next couple months are going to be really rough. Now, we believe that Kentucky is going to do much better over the next couple months than most places in America, but it's going to be really sad. And it's going to be really difficult. You know, the state of Indiana just how many days ago had over 100 deaths in a single day. And you are going to start seeing that in your community at a significantly increased rate. So the more that you can do to model the type of really good behavior and compliance with the mask mandates and others, the better. The more that you can provide the hope to all of your faculty and the rest, but also the need to be really careful and to fight really hard against this thing for the next couple months. And once we start talking about the vaccine and how it'll be distributed, it then becomes avoidable, the death or the devastation that we may have between now and then. And so I'm certainly committed to making sure that we fight back really hard, and we need your help to do that. But this type of planning will help us, I think, shave days, maybe even more off what otherwise it would have taken to start distributing this to our educators. And let me just say, I know we've all had to make tough decisions. I know this thing has been stressful. I know you get hit from all sides. Trust me. I know you get hit from all sides. But we appreciate your hard work.
Well, thank you, Governor Beshear. Thank you, Lieutenant Governor Coleman. Thank you, Dr. Stack, for being.
I believe that I am too.
Sorry about that. Thank you, Governor Beshear. Thanks, Lieutenant Governor Coleman. And thank you, Dr. Stack, for being on with us. This is great news, and we really are grateful that you've prioritized educators in this process. We'll work to be ready when this vaccine is here, and we're grateful that that you've valued our professionals and our kids so much. Thank you.
Thank you all. Have a good weekend.
Morning, go ahead and hit stop recording.